Pregnancy is a wonderful miracle, and for the next 9 months your body will go through many changes, many of which you have not experienced before. To make the most of your 9 months, we have prepared this little video. In this video we will be discussing the importance of exercise, healthy eating, effects of smoking and drinking, and use of prescription medicines during pregnancy. Did you know that your energy requirements increase during pregnancy to allow for the growth of the unborn baby and placenta? During the first 3 months, your energy requirements will increase. However, it is best to concentrate on food quality rather than quantity. Emma is here to tell us more about healthy eating during pregnancy.
During all aspects of life, especially pregnancy, it is the quality of the diet, not the quantity. The energy intake required by you and your baby is only slightly higher than normal. It is the equivalent of the additional kilojoules of a small tub of yogurt. Your body requires protein to repair and reproduce cells. It is also important for the growth and the development of your baby during pregnancy. 1 to 2 serves of protein per day is recommended, and examples include red meat, fish, chicken, milk, cheese, yogurt, tofu, nuts and seeds. It is important for you to consume calcium during your pregnancy and while breastfeeding for the formation of your baby's bones. It is recommended that you consume 2 to 3 servings per day. Dairy foods are the best sources, such as eggs, milk, cheese and yogurt. Iodine is required for the normal development of your baby. You can increase your intake during pregnancy by taking a multivitamin and adding iodized salt to your meals. Fish is a high source of iodine, though precaution must be taken to limit your intake of high mercury type. Folate. It is important from the time of conception through to birth for the normal development of your baby, and it aids in preventing some birth defects. Food itself cannot provide sufficient amounts of folate, therefore a folic acid multivitamin is recommended. An iron deficiency can cause anemia, tiredness and reduced immunity. A minimum of 2 serves per day is recommended. Red meat, fish and chicken are the best sources. Listeria is a bacterium that causes infection and is contracted by contaminated food. It can cause miscarriage, stillbirth and severe illness. You can minimize your risk by avoiding the following foods. Salmonella is a type of bacteria that causes food poisoning. During pregnancy, it is recommended you avoid the following foods. The average weight gain during pregnancy is between 11.5 and 16 kilos. Weight loss is not encouraged during pregnancy, as this can deprive the baby of nutrients for growth. Excess weight gain should also be minimized, as this can lead to high blood pressure and gestational diabetes. You are encouraged to fill up on healthy foods, exercise within your limits, enjoy the occasional treat, and if concerned, discuss your health and the well-being of your baby with your GP.
Did you know that physical activity can help you manage some symptoms of pregnancy and prepare your body for the childbirth? Annette has some tips on how regular exercise can help you and your baby.
Over the years, there have been differing opinions about whether or not pregnant women should exercise. Today's evidence shows that physical activity or exercise is beneficial to both the mother and the baby. Exercise minimises the likelihood that you'll suffer from gestational diabetes. It helps control your weight gain throughout pregnancy, and then you return to your pre-pregnancy weight and fitness after the birth. Exercise helps to improve your back muscles, which can minimise the lower back pain associated with your growing belly. You'll have better posture and strength and endurance if you exercise throughout your pregnancy. It's more likely then to have positive effects on your labour experience. It helps improve your sleep quality and duration and also reduce your stress hormones. Finally, Your newborn may be more alert and less irritable after birth if you've exercised throughout your pregnancy. During pregnancy, hormones loosen your ligaments, so your risk of injuries, like sprains, could increase. Your body will change shape, the centre of gravity will move forward, and this can affect your balance and coordination. After your first trimester, avoid exercises that require lying on your back. There's a possibility of compressing a major blood vessel called the vena cava, and this could cause you to become dizzy, nauseous, and short of breath. When you're pregnant, it's recommended that the exercise level that you participate in is moderate. A good way to check this is to keep yourself within the range of being able to talk in full sentences to yourself or to your exercise buddy. First of all, it's recommended that all adults participate in at least 30 minutes of moderate physical activity most days of the week. This recommendation doesn't change for you after you fall pregnant. But if you haven't been physically active to this level, pregnancy is not the time to throw yourself into a high intensity Get Fit program. Start slowly with 5-minute blocks and build up to the 30 minutes of physical activity that is recommended.
Do you suffer from asthma, diabetes, depression, or epilepsy? If you are worried what effects your prescription medicine can have on your unborn baby, arrange to see your GP. Your doctor will be able to tell you if your medicine is suitable to use during pregnancy. Our researcher Jody is here with more information.
It is a common myth that once you fall pregnant, you should stop taking all medications. This is not true. In fact, stopping some medications can do more harm than good. Medications can be grouped generally into 3 categories: prescription medications, non-prescription medications, and herbal or supplementary medications. Prescription medications are those which require a script from your doctor in order to purchase. They include antibiotics, antidepressants, blood pressure medication, and some painkillers and anti-inflammatory medication. Where prescription medications are for the treatment of chronic illnesses such as diabetes or asthma, it is recommended that you discuss your options with your doctor. In most cases, suddenly stopping this kind of medication can have more harm on your baby and yourself than good. Some prescription medications, such as painkillers, blood pressure medication, antidepressants, and even some cough syrups, contain the ingredient codeine, which is a known opioid. While not harmful to mother or baby during pregnancy, opioid has addictive properties and can lead to problems following birth, including withdrawal. Non-prescription medications are those which are available from your pharmacy or supermarket. They are commonly known as over-the-counter medications. They include paracetamol, ibuprofen, some cold and flu medications, and sinus and allergy medications. Products which include pseudoephedrine, such as cold and flu medication, and sinus or allergy medication can cause breast milk to dry and can cause the baby to be unsettled when in the womb. As always, seek the medical advice of a doctor or a pharmacist before taking any medications, and always read the product information carefully first. Finally, supplementary or herbal medications are those which can be purchased from your supermarket or health food store. They include all types of vitamins and supplements. While it is common for most women to take vitamins during pregnancy, choosing the right product is imperative. Some multivitamins or combination formulas contain other ingredients which can be harmful to your baby. It is therefore recommended that single ingredient formulas are the best. Remember, always consult a medical professional before taking or stopping any medication.
Did you know that smoking and drinking is harmful for both the mother and the unborn child? According to the Australian Institute of Health and Welfare, 11.7% of Australian women continued smoking during all or some of their pregnancy. So what is it about smoking and drinking that is so harmful? Our researcher, Catherine, is here with her advice.
Within the 18 to 30-year-old age range, there are two major preventable factors that can lead to poor birth outcomes. These are smoking and alcohol consumption. For the mother, the dangers of smoking during pregnancy are that you are more likely to suffer a miscarriage or to have an ectopic pregnancy. You are also more likely to deliver your baby prematurely. For a baby, their mum smoking increases their likelihood of dying at birth or shortly after birth from SIDS, sudden infant death syndrome. They are also less likely to be born a healthy weight. They are less likely to settle easily and feed well, and they are also less likely to be discharged home from hospital with you, and they also require more care in hospital. There is no evidence that quitting smoking during pregnancy is stressful for your baby. The truth is, there is no safe level of smoking, so it's best to quit completely. Nicotine replacement therapy is now considered precautionary for use in pregnancy and lactation. Pregnant and breastfeeding women should seek advice from their health professional prior to commencing NRT. For advice and support with quitting smoking, call 137 848 or speak with your health professional. It is confusing. We know that excessive alcohol consumption is very harmful, but we don't know for sure if there is a minimum safe level. We know that alcohol is a toxin, therefore it is safest not to drink at all during your pregnancy. The damage that alcohol causes the fetus is very dose dependent. This means that the greater the alcohol intake, the more likely it is that the baby will suffer adverse health effects. The most severe adverse health effect from chronic or intermittent binge drinking is fetal alcohol syndrome. Support is available 24 hours, 7 days a week. If your drinking is harming yourself or others, it may be time to seek out one of the many services that can help. You could speak to your GP, local health service, or call a helpline. There are trained counsellors available on the telephone in every Australian state and territory.